Hi, my name is Dr. Gayle Ruggiero. I am the medical director here at Sindecuse Health Center, and I am today talking with Jessica Slates, the nursing director, regarding the COVID basics and safe return to campus here at Western.
The big thing with COVID is that it's an ever-changing situation and we are learning new things daily. So this presentation here is up to date as of today, August 4th, 2020, with everything that we know and recommendations. And again, we are following the CDC guidelines and work closely with the CDC and our local health department.
So prevention is the main message that we want to encourage. We know that in order to stay safe, we have to take some responsibilities personally. That means that we need to try to maintain physical distancing of at least 6 feet. We need to wear masks and wash our hands frequently. If you're feeling symptomatic or have been exposed to someone who is positive for COVID-19, we encourage you to come and get tested with our rapid testing at Sindecuse. If you're sick, you need to stay home. Our visits are telehealth appointments, and we do outside screening for those symptomatic individuals to prevent spread.
The antigen testing that we provide here at Sindecuse Health Center is a rapid antigen test, so it tells you if you are currently infected with COVID-19. The rapid test is 96.8% sensitive and 100% specific. If providers have any question on the results of a test, so for example, if the test result says negative, however, the provider is concerned because maybe the patient had a direct close contact exposure and was symptomatic, and they are not so certain that it should be negative, then they may decide to send off a confirmatory PCR test, which gets sent out to a third-party company and does not result, usually for at least 3 days, sometimes up to 2 weeks in length.
What do those results mean? And how are they communicated? Who do we share that information with? I think it's important to keep in mind that we've done over 1,000 rapid result tests here since we started in the beginning of March, and that we've had about 2% of those tests be positive. We will be tracking and following those up.
If people are positive, then they are having a direct phone call made from Sindecuse Health Center staff. If they are negative, then they are getting a secure message on the Sindecuse portal. And we share that information with the patient as well as the Kalamazoo County Health Department and the Michigan Disease Surveillance System.
So who are we encouraging to get tested? Students who are returning to shared living spaces, such as residence halls or apartments, are strongly encouraged to get tested. That's because the spread of diseases in shared living spaces can be quite quick. In addition, faculty and staff returning to classrooms are also strongly recommended to get testing. Anybody experiencing symptoms such as fever, shortness of breath, cough, difficulty with breathing, loss of taste or smell, or respiratory illness should get tested. Anyone in close contact with a confirmed positive case, close contact being defined as at least 15 minutes within 6 feet of a person with confirmed COVID positive status with no mask being used. You can make an appointment via our patient portal, which will direct you to the proper testing times and providers to be tested with. Please don't walk in. We're restricting our building access to appointed patients for the safety of our clinic as well as the university.
So before any patient, student, employee, faculty, staff come to campus each and every day, they should be completing a daily survey, a daily symptom checker, and if for some reason you've ever had any exposure or any symptoms at all, then you should not come to campus or you should not leave your residence hall. And if that is the case, you should also be following up and scheduling an appointment at Sindecuse Health Center for a telehealth appointment to be seen and possibly tested based on the provider's recommendations.
What if you test positive? If you test positive, you'll be in isolation. Isolation can be 10 days. And also has to do with symptomatology that you might be experiencing, and that will be a partnership with your provider determining the length of your isolation and when you'll return to your activities. Close contacts will be quarantined and tested if needed or if they develop symptoms. This is an effort to keep the campus community safe, and this will determine whether or not you're engaged in activities on this campus.
Again, if somebody in your classroom, res hall, or office tests positive, we will notify you if you are a close contact, and we will not at that time share the name of the person who was positive, but we will share that you were in close contact with somebody who tested positive for COVID-19. Again, we can't share all the information because we have to keep patients' privacy information in mind. For res hall and apartments, Western apartments, We will be having a posting on the hall floor or the entryway door, just notifying that somebody in X res hall or X apartment has tested positive, but that information does not include personal details. Again, the classrooms will not necessarily be notified via the whole class, and it may not include the instructor, only, again, people that are identified as close contacts.
If employees test positive, there will be information shared with that immediate supervisor in order to aid in contact tracing. We will also be alerting that department if it's at least greater than 25 people to ensure anonymity. We share minimal information to protect privacy, but to help with the safety of the campus community. We have been given the opportunity to test individuals with no out-of-pocket costs. So there are two categories of testing: testing for people who are asymptomatic and non-exposed, and testing for people who are symptomatic or had exposure to a positive case. If you're asymptomatic and unexposed, WMU will provide you with one free screening test. If you are symptomatic or had positive exposure, we will be able to do that testing with no out-of-pocket charge as is needed by either symptoms that you're experiencing or contact with a positive case. There are a lot of insurance barriers sometimes to getting tests, and we want to ensure that our campus has no barriers to getting tested. So it doesn't matter if your insurance is by someone who doesn't traditionally par with our clinic. We want to make sure that you're here getting tested so that we can enable contact tracing through our university.
Continuing on why to test at Sindecuse, a big piece of this is keeping campus safe and healthy. And the only way we are able to keep campus safe and healthy is if we are aware of what's going on campus with regards to COVID-19. The testing here at Sindecuse, like stated earlier, results in 15 minutes, and that's a rapid result test, which is hard to find elsewhere in the community. If people are tested elsewhere in the community with a test that doesn't result rapidly, we may not know if somebody's positive, and therefore they may continue to go on about their everyday lives and possibly spread COVID-19 asymptomatically. The other piece of the puzzle is that other tests completed elsewhere will not be reported to Western unless we are identified as a close contact, which most likely multiple people at Western will not be identified as a close contact, and therefore only the Kalamazoo County Health Department would be aware of this positive, and we would not be able to aid in that faculty, staff, or student with their follow-up that is necessary. The other thing is that contact tracing will most likely not be as prompt because the testing will not result as promptly as our rapid testing.
It's only with partnership with you that we're able to keep the campus healthy and safe. That means social distancing, wearing a mask, and maintaining good hygiene. That means being responsible about if you're having symptoms, not coming to campus, creating a telehealth appointment and getting tested. If you have questions, please give us a call or email us. We're happy to help you stay safe on campus.